Hi, everyone. It's DocTalk. We're into April, and it's a really good time for us to be thinking ahead, both for springtime and nice weather, and for the end of COVID in terms of its pandemic days, and instead focusing on what is coming when it is endemic. And the difference means pandemic, uncontrolled spread, lots of people at risk. Endemic means relatively smaller groups at risk, relatively smaller impacts on the population, and localized outbreaks that occur over time amongst people who are susceptible for some reason or the other. That's really where we are now. And despite the fact that there are some new versions of Omicron that are circulating, one of them is BA2. Another one, which we're talking about here, is XK. So, kind of given some initials that allow it to be differentiated from other versions. The other version is XE, and both of them known to be a little more transmissible, but none at this point known to be higher risk. And what's really the good news for those of you who've been vaccinated or have the illness or both, that you are very well protected from these new variants as they begin to spread and become more prevalent, not only in this country, but across the globe. So let's talk about how this happens. We are protected as a herd from things that not many other people have. So if you are circulating at the mall or amongst a crowd at an incident, if not many people have a disease, then you circulating through that crowd have very little risk of contracting a disease. That has helped us across this generation of individuals because in the last 60 years or so, we have eradicated polio. And eradicated means you have no risk of picking up polio. We have nearly eradicated some of the other traditional childhood diseases, things like measles and mumps. But occasionally, there are people who were not vaccinated to measles or mumps for some reason. In particular, that people that come to the United States from other countries where vaccines aren't as readily given. And those people run across somebody who also has not been vaccinated. And when not vaccinated, that person may be at risk. And we begin to have little circles where a disease like measles or mumps gets passed in the United States where traditionally it didn't. So we could say measles and mumps are two diseases that are endemic to the population. There are also situations where it's endemic in one area, but much more widespread in other areas. And for all of you who travel across the globe, you know there are other places that other diseases, and let's use tuberculosis or malaria as two diseases that are unfortunately ravaging other parts of the globe, when in the United States, they're pretty rare. Nonetheless, if people have, for example, tuberculosis and they come to this country, we have to be concerned if they have active TB and cough on other people, because TB is a disease we don't even have a vaccine to right now. We have treatments for. Why do I talk about this? Because we are moving from that phase where COVID was a big risk for large numbers of the population to where it is a much smaller risk for smaller numbers of the population. Amongst the fire, EMS, and law enforcement services, we've had many more people who are vaccinated and have had the disease, or vaccinated and not had the disease, who are very well protected. Their immune system is queued up right now to protect from COVID. And although they may potentially get a mild case of COVID, vaccinated individuals, and in particular hybrid immunity individuals, that means both vaccine and illness, are very well protected from getting serious illness. At this time, the best science from across the globe says vaccinated individuals are very well protected from serious impacts of the coronavirus in any of its current variants. And they are protected from things that are still devastating, like long COVID, and from cardiovascular complications. That's important because people who are unvaccinated and people who got sick before we had a vaccine have had really frustrating cases, which are called long COVID, which are long symptoms related to the disease, oftentimes related to their neurologic systems, their respiratory systems, and their cardiovascular systems. Those are so very important in emergency personnel because that's the basis by which 1582, 1583 fitness for duty, really for a job that has a lot of cardiovascular stress associated with it. Those three systems have to be working at their top capabilities. And people who have been compromised in any one of those three systems oftentimes can't do their job as firefighters, EMS personnel, or law enforcement. And those people now face significant challenges in getting back to the profession they love, the greatest job in the world, serving other people. Long COVID still being studied. We know that it is very rare amongst people who've received vaccines. And for those of you who have not been vaccinated yet, you should know your risk of getting even a mild infection and having symptoms long afterwards, still those risks occur and are much, much higher than people who've been vaccinated. And even higher protection is afforded when you've been both vaccinated and received an additional jab. Hybrid people who've had no significant symptoms related to their COVID, they're also extraordinarily well protected, and they're protected from either further infection or the problems that go along with long COVID. We are still going to have to figure out how to evaluate people to return to duty, and in particular return to full duty, who've had COVID before. And that's a matter of operational medical directors from the service working along with occupational medicine physicians and working along with researchers. And we have many talented research groups that are working in the fire service to help us put together the facts related to long COVID and then to the fitness that's required for us to do our jobs. We will get more answers, and I know a number of you have been very frustrated in your ability to get straight answers, but we unfortunately have a new disease and we have limited knowledge. The implications of COVID have been to all these different systems, and some of them directly impact those three important areas. Some of them indirectly do that because COVID, we know, messes with the coagulation system and in some cases cause clots. And those clots occur then with a brain implication or a stroke, a heart implication, or things like coronary artery disease and cardiac arrest. And in the respiratory system with blood clots in the lungs and with damage to the lungs that don't allow the lungs ever to function the way that they used to. So those of you who have these ongoing issues, please work with your primary physician, work with the knowledge that comes across in the media and from research studies related to COVID, and pay attention to what's going on in the occupational medicine arena, because that's where all of this has to come to impact those people and getting them back to work. Still, for all of you, vaccination is better than not vaccination. And as we're at a lull now in the development of the disease and in progression across the country, you're really at a good point to get your additional jab for COVID or to get your primary series if you haven't had any of it yet. We have an opportunity to move into the summer at very low caseloads, and that's what we're all hoping for. There is now kind of a meandering line in terms of number of cases. The hospital cases are at record lows really since March and April of 2 years ago when COVID was first spreading in this country. And so we're at a very good phase in terms of health service implications. We have the opportunity over the summer to further reduce the amount of disease. Summertime, we're going to add another vaccine. We talked about that last week. We're going to get more treatments available for people who do get sick with the disease, and we'll get better contact tracing that will allow us to nip in the bud any of those cases that start with a couple people and then start to spread. With contact tracing, we can reduce that impact. Getting everybody back to work and getting everybody comfortable with a new level of coronavirus in the community is really important. And as we get to the fall, will be even more important. We also this week learned that research is going on about adding the COVID vaccination to the flu vaccination. So a combination vaccine that would come out. So prior years, you got an injection or a spray in your nose that had both influenza A and influenza B types in it to protect you from the flu that season. Possibly you would have the injection available in the fall that would be both coronavirus in types of influenza A and types of influenza B. That would be a win for all of us. So April, it is a positive time in this disease, a frustrating time, but research nonetheless going on for those of you who suffer the long COVID issues and the frustrations that go along with it. Stay safe, get ready for warm weather. We move ahead into the summertime. Thank you very much. DocTalk, April. Let's go forward. Thanks.